you've been to both halves, is it on? Is it on? Okay. Anyway, so it's, if you've been to both halves, you get extra credit for having been to both halves. If you testified at both halves, like Ms. Bartalik will be, you get really some kind of a plaque at some point in your career. Anyway, so for those who weren't here this morning, just a summary of what we're doing in the interim times. Clearly the morning event happened with some topic that you probably don't interested about, but we were talking about PCAs and fraud. Tomorrow we're going to talk about data sharing and county functions, and also some more discussions about fraud. And there actually was a breakthrough consensus. We're pretty much all against fraud. It came to I was quite shocked. And then we're going to do nothing in October, and then we're going to come back first part of November and have another 2-day run at some of these same topics. And that will be the extent of our work this year on this committee, barring something happening, which I hope nothing does. And then we'll look and see what's going to happen in January, February, child protection, and I don't know what else. But we're trying to deal with topics that are of broad importance that we've been working on. There's been some changes in laws or whatever. And so anyway, welcome to MnCHOICE world, and which is an amazing program. Anyway, and I do want to just do my disclaimer in the beginning here. We had lots of discussion about this in a lot of rooms. There were less hearings on it than we had, some testimony and discussions about it. Noticing that it's gone to $250 million in a biennium to assess people when we have some people who have critical needs we can't serve, kind of just ran me the wrong way. And so, and hearing some of the discussions, at least privately, where people are unhappy with it, and then later they're like, oh no, we're not going to do anything. It was interesting. And so we had a proposal for, I think, 50% reduction at one point, and I knew that was not tenable. I thought I could get a third. And at the end, I realized 10% is a reasonable number to go forward with. There were some changes in the bills. We'll be discussing that. And some flexibilities that have been offered, which may or may not be sufficient. But 10%, oh, I thought it was a different number. Just so you know, in the interest of openness, and it was a very interesting end of session, shall we say. We got a call right at the end. Apparently they needed more money to support whatever other programs there were, and since we'd found a method, so if since we found 10, could you go 20? And I found that, and that wasn't by anybody at the table here. This was all by the hierarchies, the people who were making decisions, and they said, well, we'd like to have you go 20%. And I thought that 20% was not a tenable number. And so I said, well, how much do you really need? And so we just backfilled, and so it became 16 and 18%. And the ironic part about that, I won't use the word funny, but ironic, is that at 10%, a lot of the county individuals might have said, well, another bludgeon to us, we'll just suck up and handle 10%. The 16 and 18% is some real money. And I never had an interest in hamstringing the assessment process or doing anything to undo all the great advances we've made. But it's a good rehearsal for us preparing to handle the money that's going to be available to us. And at some point, both parties are going to realize a $20 trillion federal debt is a lot of money. And when rates go up a point, we are going to hate that. And so what's going on now between Minnesota Care and all the Graham, whatever bill that's going on and all that, something at the end is going to stick. And we're going to find ourselves with state control of monies. And this discussion, to me, is a proxy for how do we spend our money on people with disabilities? What do we get for it? How do we triage? How do we decide that somebody needs something and somebody else has a lower need? And I will just assert to you that a person with a 12-hour-a-day need for PCA is a far different client than somebody who has a 1-hour need. And until we serve all the people that have the 12 and 11, 10-hour needs really well, the 1-hour needs are important to me, but they don't rise to the level of being essential. And those are discussions that we had in 2011 at some point, and we need to continue on. Because our enemy is not Republicans or Democrats. Our enemy is education, and transportation and roads and bus service for people with or without disabilities. And they're not really enemies, they're just people that are competing for the same pot of dollars. And that's the challenge that we have. How do we justify what we want to do here and preserve services for all the million people that we so desperately want to serve in the best possible way? And so that's a preamble to that, and the department actually in concept shares what I said. I'm not speaking for them, but we all agree that we have to find a way to serve everybody that needs what we do. And the compassion in this room, at the table and in the audience and at the witness table is extremely high. And the need for serving is just as high. So, and that's been my leadership all along here, has been how do we do what we have to do and give everybody a chance to be all they can possibly be in our wonderful state. So, and so this is beginning a process of discussing MnCHOICES and perhaps other services to people with disabilities. This is the first meeting, and it's going to go wherever it goes today. We're going to revisit this early November, and I'm going to continue to, in a kind way, push the department to be more and more flexible and innovative as they collaborate with the counties. So I'm pushing to be more and more innovative and flexible in an effort to get the most value we can out of whatever remnant of that $250 million we really have to spend. So, and my door is open to anybody, and I have a bad memory for remembering your name if you want to be confidential. But I hope the counties especially don't feel as though they just have to hunker down and endure another, what they see as a cost shift. That's not the intention whatsoever. The intention is to get more value for the same dollars. Because after all, the dollars come from the same group of people who live in this state, whether it's county property tax or sales tax, income tax, or federal. So anyway, welcome to the committee. And Ms. Bartalik, are you the award-winning two-person today? Oh, no, we have a, okay. Welcome to the committee.
Thank you. Chair Abler, members of the committee, my name is Deb Schustrom, and I am the Director of Human Services at Auditor County. And I am here as a member of the Minnesota Association of Social Service Administrators. As a part of that, I'm also a topic lead that includes long-term services and supports, which is where MnCHOICES falls. And so that's how I'm at the table. I also have, as in that role, have also participated in the Home and Community-Based Services County-State Work Group and the collaboration that the counties have with the department around home and community-based services. In my tenure at Auditor County, I've also supervised those programs in the past, so they're programs that are somewhat near and dear to my heart. So today what we're going to do is go through an overview, some history, goals, and benefits, the path of continuous quality improvement, how are we trying to improve MnCHOICES, and the assessment process. What are the IT considerations? We're going to review that information with you, and also some of the legislative priorities from 2017. And we'll be doing that in tandem. And then following this informational portion of the presentation, you'll hear from Ramsey County Commissioner Tony Carter and Stearns County Human Services Administrator Melissa Huberty, who will present some information representing AMC and MACSA's perspective.
And Mr. Chair and members, I'm Alex Bartalik. I'm with the Department of Human Services, and we have been on this journey for a while. So before we jump into the details of MnCHOICES, we wanted to give an overview of the foundation of why are we even here. And some of this started a number of years ago of concern that our system was really funding programs. People would say, I want PCA, we'd assess and fund, give them PCA. So they were asking for what they knew and not really how were we deciding what was going to be the best services to meet their needs. So the fundamental question we were trying to shift was not what programs do you qualify for, but what do you need so that we could really use professionals to be able to work in their local communities and figuring out the best ways of supporting people's services. We did after 2011, spent quite a bit of time looking about reforming long-term services and supports. And this is a graphic that came out of some of that work because we were realizing that people were looking at waiver services as being the golden ring. They wanted to apply for the waiver, get on the waiver. There was a lot of discussion about I want a group home or I want this, but not a lot of discussion about what is really important to you, what's happening in your community, what is happening with your family, and really wanting to create a different way for our system to respond. A way of, instead of incenting people to go to some of the more intensive services and stay there forever, but to really figure out how do we bolster and support communities? How do we support families in different ways? How do we provide different supports to maintain independence, to be able to increase independence, and when people need intensive supports, great, have it, but not assume that it's going to be there always, that they might not need that all the time. So how to create a more nimble system as we went forward. Some of the basic concepts that are really behind this different way of trying to do assessment and support planning is trying to find a balance between how do we keep people healthy and safe, which our system was great at. We had a lot of services, and we had great providers, and we had a lot of 24-hour staffing of things, but much of the focus was on health and safety. Now, that doesn't mean that we just want to say to people, what do you want, and whatever you want, no responsibility figuring it out. We need a balance. We need a balance in trying to think about what's important to people, what's important for people, meaning how do we make sure we're providing the right health and safety. That will vary at different times of a person's life. It will change depending on circumstances that might not have anything to do with their own needs, but we need to understand all of that. And this is really the transformation of how to achieve a balance in our system, how to talk about managing risk in different ways, how to talk about different ways of delivering services. I want to spend just a moment on informed choice because almost all the time we get this question, saying, what is informed choice, and does that mean people get to just pick whatever they want and isn't that expensive? Informed choice is really how do we help people understand what they want? Not that they want a group home, but what do you want? Where do you want to live? What's important to you? What would be the purpose of being able to have that kind of support? The person needs to know what's possible. And what's possible also needs to include what they want. So we have people who've said, I want to work, or I want to live here, and that hasn't always been available for them. That's not a true choice. We need to be able to support them in that. We also want to have a system where people understand the different risks and they understand the trade-off. So if you do this, we might not be able to offer some of these other supports, or if you want chances to be out in the community more, what does that mean for how we have to deliver the supports? It's going back to finding that balance. And informed choice has boundaries, and it has boundaries for all of us. So there's some things that are imposed by law, certain things we don't get to choose to do. Some things are by values. Certainly when people who choose to live together, share services, family situations, your choice affects other people, and you don't get to do whatever you want. You have to negotiate it. It's also resource-driven, and how do we allow a process where people can understand what some different options are, that they can make decisions within that, and that there's also the potential for some different types of risk. And I'm talking about that because that's the foundation. If our system is going to change, if we're going to be able to develop different services and be responsive not only to what people want, but to different demands in our system, we need to be able to get to that very rock bottom. MnCHOICES is an assessment and support planning process. It isn't just assessing needs, it's a bigger process. It's part of a multi-year process to be able to really reform our services and supports. The tool itself is a web-based tool. It's a tool that we expect professionals to use. It cannot substitute for professional judgment. It also is a way of allowing them to look across all of the different programs and services to see what's going to be the best to meet somebody, not just based on their needs, but also what they want out of their life, what they're interested in doing, and what will help with them with health and safety. So being able to look at how we can really provide informed choice and how we can also make sure that we're determining eligibility more accurately and more quickly as we go forward. MnCHOICES replaces current assessments. It currently replaces what had been done through a developmental disability screening, through a long-term care and consultation, and personal care assistance. This is basically looking at eligibility for all long-term services. So instead of saying what program and potentially having different assessments, it looks at needs and it helps understand, are you eligible for nursing home and what options might there be, for example, to nursing homes. It's used for all ages and all disability types, and there's rule-based applications that can help guide people through so that we are getting consistency in the results that we find based on the statute or regulations that are going on. It does not change policies for program and service eligibility. It does not change any of the criteria for level of care, and it doesn't replace some of the diagnostic assessments that are needed, for example, with a mental health assessment or mental health services. There's referrals to that. And this is an important piece because there's a lot of the process that has changed, but we actually took those very questions that determined eligibility or the number of hours and moved them into MnCHOICES. And as you'll hear, that's something that we would like to be able to address in the future, but we wanted to make sure we were not confusing a change in how we did our process with the actual eligibility criteria or level of care determinations.
So over the course of time, the Department of Human Services and the lead agencies, counties, have worked together in a partnership for a number of years, actually. Alex and I were reflecting on this. She had some involvement with this before she ever even came to the Department of Human Services. Auditor County piloted a version of MnCHOICES before it was even MnCHOICES. And so counties have had some voice in this for a number of years. It's not a come to the table at the last minute. In that, the state's responsibility in this partnership includes the things that you see on this slide, providing that administrative framework that supports a person-centered practice, and including providing the functional assessment application and ongoing training for lead agency staff, ensuring that we have appropriate and adequate training for our certified assessors. The state has a responsibility for analyzing the data that's being produced by the assessments and the information that's gathered from it, as well as resourcing the administrative functions for lead agencies. The lead agency role is to continue to play a critical role in MnCHOICES by having the staff that are available to do the assessments and having the actual, the physical technology, having laptops that can do the work and provide for getting the assessment done when you're out visiting with people in order to complete that person-centered assessment and identifying the strengths and the area of needs of that person, and then providing for and directing the services in our local areas. Over the past several years, as I've already mentioned, we've worked together with the department, and some of the ways in which we've done that is that piloting of MnCHOICES, piloting version changes. We've participated in work groups. There are work groups like the MnCHOICES Advisory Council. There's a reassessment work group. Counties have identified mentors within the counties that can work with DHS to answer questions, deal with issues, and then bring that information back to the counties. It also provides, these work groups and opportunities provide for a feedback loop. And it's vitally important and critically important that lead agencies continue to have that feedback to the department for where can this application continue to be improved? How can we do assessments in a way that better serves people and gets to what it is that they need to be able to be as independent as possible in their communities?
When MnCHOICES started, we had some original goals. We wanted to increase consistency and transparency in access to services. We didn't want it to be a surprise. We wanted people to understand the basis for their eligibility, to make sure we were providing access to the right service at the right time, changing the curve of people asking for what they know exists and instead saying, what is it that you would like to have, and looking at how we can develop that. Being able to look at how we can really make this assessment and support planning process focused around the person and let them inform the choices that are going forward. We wanted to improve accountability and improve the quality. We wanted to foster a shared vision and a culture of innovation to really be able to try different things and see how it could work and to strengthen the partnerships and collaboration. A few ways that this has been done. One is by certifying assessors, by saying this is a complex job. This is access to the system, and those questions and that conversation that occurs right from the beginning or annually really sets the course for how services are authorized and what options people even know. So we train people, we go through certification processes, and we continue to work on building their expertise. Another question, which I know has come up recently as a point of controversy, is many, in fact, the majority of assessments were done by the county where the person lived. So all of the aging services and PCA. The disability services hadn't done that, but as we looked at this, we wanted to assure that people were being assessed by folks who understood the resources in their county, in their region, who would be able to help look at some different options there. We also knew that many of the counties were frustrated that people were moving into their county. They were moving in when there were openings and coming into beds. And so having a local assessor was saving on travel time, which is saving on money as well as the time of the assessor. It's providing the county, however, also with information about who is in their county. It's allowing for that conversation, and if somebody says, well, this is the only place I could go, but I really would rather live here, there's more information to be able to talk to the other county about what is going on. Being able to really figure out also how to build on what's available in the community, what kinds of housing, if people want different activities. So we know that that was something that was really important to be able to make the assessment successful. Now, from a policy perspective, this has a lot of value, and I know while it's somewhat of a work issue, there was reasons for it. I think the county share has highlighted this in a different way, because all of a sudden those hub counties that had services are potentially paying for a higher share because of all the people living in their counties. So that was an unintended consequence to something that we have to look at. Money is part of what we're here talking about, so how do we pay for MnCHOICES, and how did we make the change? Assessments are administrative. These are gatekeeping functions. They determine eligibility and help us manage our Medicaid program. And DHS delegates many of our Medicaid activities to counties to do that. And determination of eligibility is actually a core county function. That's not me saying it from the department. That was something that as we worked with counties, they said, boy, this is what we do, our financial eligibility, program eligibility. We have a responsibility for managing resources, and it matters to us as well to make sure that people are getting linked with the correct service. Prior to MnCHOICES, counties were reimbursed for this assessment and support planning process in multiple ways. So yes, we're spending money now, but we were spending money before, and it was often in ways that was very difficult to track and to even put together in one piece. Reimbursing these as a service, because some of them were reimbursed as a service, for example, through medical assistance waiver service of case management, is actually a violation of CMS. We can't fund gatekeeping activities out of a service, and so we needed to clear that up. We also have state statute that requires us to separate administrative from service activities and to prepare Minnesota for a time when case management could be available through a choice of vendor for people on the waivers. So we had a number of reasons why we wanted to make sure we were really clear on what were administrative activities versus service activities of case management. So MnCHOICES are administrative, they're eligibility assessments, and the mechanism in Minnesota for reimbursing counties and tribes for their administrative activities is the random moment time study. Now, these time studies draw down federal participation through medical assistance, and they reimburse counties with federal match to their dollars for activities that they are doing to administer the Medicaid program. What was different with MnCHOICES is the state legislature agreed to use state funds as the non-federal match. So MnCHOICES was intended to fund and pay counties for their administrative time doing these type of activities, just to give you a little bit of a flow of where we got to for using that particular payment methodology. MnCHOICES has benefits. We wanted to make sure we could really tailor services, that we were having an opportunity to listen to people, figure out their values and priorities, and adjust the services around that. And in fact, when we were holding focus groups and doing testing, even very experienced case managers who were testing this were coming back and saying, wow, I learned some things about this person that I never knew, and it does change how you go about thinking about services. Making sure that people really are able to understand their service options. So it might not be, do you want to live in this group home or this group home, but how to really help people talk about what's important to them and what are different options. It's not saying group homes aren't part of the equation. It's just making sure that people understand all the different ways that they could have support on where they wanted to live and work. Promotes equity, making sure that we're really able to do this across populations, across different parts of the state, and assuring that we are being more consistent and coordinated. I mean, again, a person might have had a PCA assessment and a PCA support plan and a DD assessment and a DD support plan, and they weren't together. And we wanted to make sure that we were managing those in a more joint way.
So some of the things that MnCHOICES does to benefit lead agencies is that it does provide a statewide assessment that, and support planning process that's standardized in order to determine the level of care and eligibility for someone. It's a single assessment, one door, if you will, as compared to multiple assessments for someone. The process provides greater consistency across lead agencies. There's with certified assessors that have been trained and know how to use this application, know how to do those assessments. It is a more consistent or greater consistency across lead agencies. There's a single support plan that addresses all the long-term needs of that person as compared to separate plans. In the old world, we had as many as 3 different plans, 3 different assessments. It could be very fragmented. This does provide that single assessment. It's a comprehensive assessment. One of the conversations I was having with our social service supervisors about what's a benefit to MnCHOICES, what's something that you guys have found and our staff have found that's been beneficial about it is that they feel that the certified assessment professionals, when they're conducting a person-centered interview using this application, they're gaining more information, learning more about the person using this than the old paper documents that we used. So that's a real benefit to this.
We also wanted to use this process to be able to improve quality. We want to make sure that we're increasing our consistency, that we're reducing the amount of variability just because of different people and different skill levels coming into this. We automated a number of business rules. So instead of somebody having to remember how all the different policies come together, there's ways that the system actually automates it, guides them from one thing, helps them understand where we're going forward. It helps us establish eligibility, budgets, what you're eligible for, which services. It also generates data. And this builds off of this morning's conversation. We need to evaluate services and programs differently. We can tell you how many people got something, and we can tell you how many hours, and we can tell you what it cost, but we don't always know if it made a difference in the life of someone. This tool is really designed to say, during the assessment, this is what we found not only about a person's needs, but what they wanted out of their life, what they wanted services to help them accomplish. It moves it right into a support plan so that then you can say, this is what the services are trying to do, and that allows us to evaluate whether or not we're actually getting those outcomes over time. It helps us figure out where we have deficiencies. It helps us understand how we could make more targeted remedial action, and it really is going to be a great source of information for you as you're making future policy issues, because we're going to be able to know more about what's happening with people and the outcomes and what investments actually made a difference for someone. When we talk about MnCHOICES, it's more than an assessment. I think it's often thought of, well, you just determined eligibility before doing this, but now why is it taking so much more? It's an assessment, as I said, to understand people's needs, being able to try to figure out that important 2 and important 4, but it also is a support plan. And there's a lot of components to that. How do we, even when people come to us, go through an intake process that's meaningful and gets us pointed in the right direction? health plans, because they will be doing MnCHOICES in the future for people on elderly waiver, for example, where they manage all their services. They have Medicare mandated activities, including a health risk assessment. This incorporates that. And then the support plan incorporates a lot of different levels of detail. So it really moves right from what an assessor does right into what a case manager does. And it includes all the documentation about how the rates were delivered. I know you've been hearing over time about the disability waiver rate system and concerns about this. This is actually going to put the basis of why that person's rate is what it is right into the support plan, so that they have, that person and their family has that documentation as well. We know that this has not been a smooth process. It's a complex issue. We're taking practices of decades of practice, and we're making a lot of change. And we're not doing this in isolation. We're changing the service standards. We're changing how we pay for services. We're making a lot of changes in the system in addition to this. In 2016, people from across the department, after consulting and working with our partners at the counties, went around the state, and we met with assessors in every county. We met with their planners and their managers and their directors to find out what's working, what do you do that makes it work well, what isn't working, what could we do differently, and we learned a lot. We learned that there's certain business practices that would really be helpful for other counties to adopt. We learned there's great variability in the infrastructure within counties, and we have to have a process that's flexible to that so that we are able to be responsive to what counties also have. We also learned that there were kind of three buckets of areas that things were falling into. One was, it takes a lot of skill to not only conduct a different interview, being able to understand all the different services, and do it on a computer. So we know that we need to really work and support those people who are doing it to learn a new practice, a new way of doing business. We also know that the tool itself wasn't working as effectively and efficiently as it could. So remember when I said we didn't change any eligibility, we took all those questions and brought them over? Well, that meant some people actually were asking 2 or 3 questions on the same topic. We need to be able to manage that in a different way. We also know that we want the tool to support it. Some people were asking every question. That isn't what it was intended to do, so how can we better have the tool support that interview and not just documentation of the question? And there were also system issues just about when there were system improvements being made or if there were outages, and Tom will be able to address what's been happening to further respond to some of the IT lessons that we learned. One of the things, as I mentioned, that we are doing is we are revamping the tool. We know that we need to structure it differently. We need to streamline some of these questions. We need to set it up to really follow more of intuitively how somebody is going to do this. And we're in the process of redesigning it right now. And some of the features we're really excited about is we want this to work for experienced assessors as well as new assessors, to have little boxes that if they're getting stuck, they can look up some information, get some help right on the spot. We're separating out some of the eligibility and quality so we can get the eligibility determined, and some of the quality things can occur later in the process. We need to make sure that CMS and state requirements are met. We do have to do annual assessments of people's needs, look at continued eligibility and do annual reviews, but how can we do it in a way that's streamlined where it's appropriate? How can we support inter-rater reliability, make sure we are getting that real-time guidance, and also making sure that we are able to tailor it so it can be adapted more easily to people of different ages or if they're being served through a health plan. So the benefits we're thinking that's going to happen with this next iteration we're working on is we will be able to reduce interview time. We will be able to focus more on what's important to people. We should be able to leave them with a better understanding of here's your support plan and what's coming up. Lead agencies will have clear definitions about what's going to be the most important, and it goes back to we can't maybe do 100 things well perfectly, but we could do this many really well. How do we focus on that? Get faster, streamlined process to reduce the interview time, eliminate redundant documentation. And for us, we'll see greater accountability, we'll get better inter-rater reliability, and we're also going to get some better data to really be able to evaluate and inform our policy decisions. And I'm going to turn it over now to my colleague Tom Kine, who's going to speak to some of the IT considerations.
Welcome, Mr. Klein.
Thank you. Mr. Chair and members, I'm Thomas Kine. I'm with Minute Services partnering with DHS, and I'm the Microsoft Application Development Division Director responsible for MnCHOICES development activities. I'd like to thank you for the opportunity to talk about MnCHOICES with you today. To recap what has been said, MnCHOICES supports several business processes related to long-term care, including both intake and assessment and support planning. The computer system is divided into these two modules, and they were developed separately and implemented several years apart from one another. Intake and assessment, which was the first module to be implemented, supports workers in the field. It allows them to take the assessment offline or disconnect from the network, go to a client's home, perform both the assessment and eligibility determination, then return to the office and upload the information to a central database. The support planning module being implemented statewide now uses information gathered during the assessment as the basis for planning to meet clients' needs. The intake and assessment analysis and development efforts started in 2010, and the software was first implemented starting in late 2013. A combination of purchase components supporting specific functions and custom coding was used in the development of the application. A purchased framework, for instance, supports the reporting required to meet business needs. After experiencing server outages in 2016, a technical review of the MnCHOICES infrastructure was conducted. And as a result of that review, changes and improvements have been implemented. Because of those activities, servers supporting MnCHOICES have greatly increased in reliability and uptime. Data synchronization when reconnecting to the network relies on a purchase component as well. Users have experienced problems with the synchronization process. Rework and reconfiguration of that component has resulted in a more stable and reliable process when an assessor comes online after conducting a field-based assessment. In support of MnCHOICES development, the quality assurance team has introduced automated testing of the application with more than 250 tests running after each programming change. Business rules are also routinely regression tested in an automated fashion. Automated tests continue to be added, improving the quality and overall reliability of the application. All of these activities and improvements are feeding into the technical redesign process being pursued simultaneously with DHS's business process redesign work and in partnership with the counties.
Mr. Klein, you provoked a question from Senator Hayden.
Well, thank you, Mr. Chair. Thank you, Mr. Klein. This is just kind of a basic question. I reached over and asked Senator Ralph. Can you explain to me why we are using the model in which we collect data, have it on a laptop, and then reconnect it and transfer the data to the hub as opposed to using a cloud-based platform?
Mr. Klein.
Mr. Chair and members, the reason for that particular technical design decision is that we don't, in all cases, have connectivity within the client's homes to the cloud. So if an assessor is in a client's home and doesn't have access, for instance, to the home-based network, they have no ability to perform an assessment in that manner. Particularly in some of the rural areas of Minnesota, connectivity is spotty. My own technical assessment of that is that the landscape is changing, and over the next few years, connectivity will continue to improve, but at the moment, it still is a problem. Senator Hayden.
And then just as a follow-up, so I know beyond just the technological capabilities and upgrades, and I can appreciate that in greater Minnesota, doesn't that put the client's data at risk from someone getting a hold of the device, the laptop, say as they go to lunch and someone breaks in their trunk before they can get it back to wherever they have to download it and erase it? Does that, what's the risk of walking around with client data in their laptop?
Mr. Klein.
Mr. Chair and members, the data on the local laptop is stored in an encrypted binary format, so it is encrypted on the local machine. With MnCHOICES 2.0, we're discussing a requirement that all these laptops be encrypted And at least in the case of state-managed laptops, they are encrypted. So there's a double encryption in that case, and I suspect that most of the counties are encrypting their laptops in any event.
Okay, keep going, thanks.
So the project team's expectation is that we'll begin implementation in late 2018. We're working across Minute in order to evaluate options and develop the highest quality product possible. So the Minute team includes project managers, business analysts, user interface and user experience experts, a technical architect, developers, and quality assurance and release management staff. And we're engaging with both DHS and county staff in order to understand and document requirements as thoroughly as possible. The technical architect and developers are collaborating closely in evaluating the development options best able to meet the needs of the field workers. And we intend to provide frequent releases of product prototypes as it's being developed in order to ensure DHS and county staff have the opportunity to provide feedback early and often. And throughout the effort, Minute is participating as a partner with DHS and county staff in order to develop a robust, stable, and efficient platform able to support assessors in their field work, and ultimately in developing care plans for some of the most vulnerable Minnesota citizens. Mr. Chair and members, thank you again for the opportunity to speak, and that's all I have for you today.
And we have some questions for you, Senator Kiffmeyer.
So, Mr. Klein, question I have for you on the slide here talks about constructed with a combination of purchased and custom-built components. When you say custom-built, is that in-house by Minute or custom-built exterior?
Mr. Klein.
Mr. Chair and members, we use a combination of staff augmentation and Minute Services staff for the custom-built components of the application.
Senator Kiffmeyer.
Okay, and so how do you deal with license and maintenance when you have that mixture of purchased and custom-built?
Mr. Klein.
The majority of the components are licensed on a yearly basis, so we have yearly license fees for the purchase components that we use.
Well,
Senator Kiffmeyer.
Yeah, thank you, Mr. Chairman. One of the things that I see the whole process in what you're doing here, but one of my concerns that I have is what we hear frequently is that, well, our license is one thing, and then the maintenance, and then we have to start over and do another one, build another one, and do that, versus adapting and fixing what we currently have. And so I just have, in general, questions about that whole thing, especially the cost of IT projects, especially software to begin with. And so the constant almost redoing and redoing, upgrading and certainly improving the functionality and the design, absolutely. But it's the platform by which you function with. So at any rate, I just want, my specific question was about the custom built and in-house, and I think generally where I'm going, it just seems like in a Minute situation like that, we must be able to have more people who can actually write code. It's very expensive to have outside consultants, very, very expensive. And then also, there's a variety of other issues there. So maybe we can just have that discussion for the subject matter today, Mr. Chair. That's the end of my question.
And Senator Kiffmeyer, you have a committee that actually talks about some of these very matters. And so just given, I mean, with all respect to the witness, the history of Minnesota's efforts at technology on our own have not been legendarily successful. And so I think the oversight we can provide and have us not do something would be productive. And so that's
Mr. Chair, more than that, I've experienced building a Minnesota software system that is still functioning and without all of the licensing and maintenance and all those things, and has been adapted and facilitated all along the way. I know because I led an agency that did that and is still functioning today, and we are well into 15, 16 years. So I know that there are ways to accomplish this that are significant savings to the state of Minnesota. And yes, you're right, Mr. Chair, this does come under my committee's purview. So I just took advantage of the opportunity to ask this question. Thank you.
Just trying to add gas on the fire. Senator Hoffman.
Thank you, Mr. Chair. You're a gaslight today. Is that the I have a series, I guess I want to see the process, and thank you, Ms. Bartalik, for going through the discussion about what started last year, what actually started 4 years ago. And I'm interested, as you talk about the process, about how the system became so fragmented, because what we saw anecdotally, and people from all over the state were calling me regarding the process and how, they had to check every little line on that computer piece that you had talked about, and talk about the training of the person that's doing the actual intake discussion, because, one just sticks in my mind. The family had to wait around, I think, 6 hours and just sat there, and it really was not pertinent to anything that the individual, their daughter, really needed regarding the needs assessment, regarding what eligibility, what she really needed in order to, be part of our great society that we're talking about, the things that we all want to see be successful outcomes. And I know that was part of our discussion last year, and why we challenged the department and why we challenged, just because it almost felt like that stuff was going, unnoticed in the bigger picture. But so when you look at that, how did you connect, or are you connecting with the training side of this, so that people are trained to have some flexibility, and that they're not sticking to the process that is long, boring, not family friendly, not client friendly? How are we rolling out that training? And then my assumption is that you two have had the conversation about how to make that look, and where we're at in that process. So I guess I'm just looking for that conversation, because there are a lot of people that were just set on the side of the road and felt like they weren't even being accounted for. And I noticed one thing, Mr. Chair, and then I'll be done, and I'll just open that up for conversation, is you talked about planners, you talked about the assessors. Did you talk to the staff that were in the trenches, that were actually the ones that were doing the work? And did you talk to the families that were sitting on the other side of that table as that evaluation or assessment was being done? And you're shaking your head yes, so thank you.
Ms. Bartalik, you can answer all 5 of his questions.
Well, let me give a general answer and see if I can hit most of the points. I think one of the things you're highlighting is something we underestimated, and that is, what does it take to really implement significant change? We were having people who might have done a DD assessment now trying to understand all the other programs. We had people who had to learn how to use computers. We had people who were learning a whole different process. So there was training. There was training trying to walk through it. We developed the training with people in the counties. We tested things. But I don't think we anticipated or understood how profound of a shift it was and how much time it was taking. And then if they were out there and there was an unexpected outage where maybe they couldn't stay connected, it just added to it. So what we have been doing is a lot of work on, how do you come at this? How do you ask the questions? And we have been doing a lot of reworking, kind of thinking, okay, how can we help people understand how to do it? One of the side effects, for example, is that we wanted people to understand what they were eligible for and understand it. So the eligibility is actually determined while the person's sitting out there, and that's a determination that the computer kind of makes sure that if you've answered these things, this is what we think the eligibility is, and if you're not getting it, what did you answer, to make sure that we're getting consistency in results. But people, what we learned, one lesson, is that it was so intimidating for an assessor to think that a whole appeal might rest on their trying to make a decision in the field. So even though there is flexibility in using professional judgment on which questions you need to ask, they were afraid. And they were asking more than they needed to ask, because they wanted to make sure that they didn't leave anything undone in case it was questioned. So we have learned a lot about that. We've learned a lot with the people actually doing the assessment. They've been invaluable in helping us figure it out. We have revamped the training. We are reworking the assessment to really follow more of an interview. If you walk in and you see somebody and you talk with them and you can observe a lot, you don't have to necessarily ask those questions. You know what those answers are. And how do you use information from previous assessments rather than asking them all over again? How do you know what's already been asked so that you can be strategic in how you are asking those questions?
Senator Hoffman.
Mr. Chair, thank you, Ms. Bartalik. It reminds me of when we were changing the early childhood, you were there, from Part H to Part C, there was a researcher who was talking about how you do a family strengths-based assessment and leaving all these check marks away and turning it into a personal conversation. That same researcher went on to serve, he's at Vanderbilt University, Dr. Rob McWilliams, and that conversation was 30 years ago about how to do it. So it's interesting to hear that here we are 30 years later having the same conversation about the effective help-giving skills that you're trying to get the staff to get to. And if there's anything that's needed to do that, I think we should really focus on getting that training up so that folks aren't being so dogmatic in their approach to assessing and checking off and teaching that flexibility. You know, it's easier said than done, but it really takes a lot of purposeful planning on the front end side of it, and I don't know what that would take in order for the department to get more staff to be able to do that, or not that I want to give more staff. No, but seriously, there's already some good data out there and some disciplines out there that get to those end results, so thank you.
So, Mr. Chair, and
Yeah.
Deb can chime in, it's the two parts. We can train people, but we also need to make sure that the system and the application is supporting their work in a more effective way. And I don't know if there's anything, Deb, right now you wanted to add?
I don't think so. I think you covered it well.
Okay. We are very much working together, and this really is a grassroots. The changes we're making are based on people who are in the field saying, this is what works, this is what doesn't. We try to keep it within the parameters of what we really want to get out of it, but how to figure out how to support them.
And what I hear from that is that the department admits that it's not quite what they would have liked, and they've learned a lot of things, and some of the challenges are very real, and now you're working on a one-year plan to make something better. Mr. Klein, so you're a division manager at DHS, or with the minute, and how big is how many IT people work at DHS?
I believe it's between 600 and 700.
Yeah. I can't imagine that many people in one room. So, and that seems like a lot of people. And I'm actually a fan of state employees, and I like to support them. But I don't know what 700 people would do all day with whatever they would do. So why do changes take so long? And why is this a one-year process? And why can't you go and fix some of this with 10 of those folks and solve some of the, can you enlighten me just just give me a 1-minute summary of how hard it must be to do anything?
Well, Mr. Chair and members, some of that is somewhat out of my purview as a division director at my level. I will say, though, that there are a large number of systems that we're supporting within the agency, and it's quite challenging, particularly in the case of an application like MnCHOICES, where we're inserting a piece of technology into the assessment process where individuals are vulnerable, and I'm very conscious of the difficulty of doing that well, not having it get in the way of the assessment process, and having it be an effective adjunct to the real business at hand, which is meeting the needs of the individual. And it's quite easy for the technology to get in the way of that process. So, as an example, in 2010, user experience and user interface expertise was very new at that time in the IT field. Today, with those kinds of resources, we're doing a better job of designing tools that are used more effectively.
You know, I appreciate your answer, and I know you mean well. I have no idea what you said. But so, I mean, it's not concrete enough for me. But so let me ask you a concrete question. Some of the modules as you go through the screens are just not relevant at all to the case you're having. How hard would it be to have a not applicable box on each of those screens, and you can just continue through instead of having to go through? And so why couldn't you have done that? I mean, with all your concern for the disability and all that, but why can't you make a practical change as simple as that on this without waiting for 2018? Is that a fair question to ask you?
Mr. Chair and members, it is a fair question. From a technical perspective, yes, you can do that. The considerations in there are within the rules, they're interrelated, what all would they impact? How does that impact the rest of the flow of the tool? So there's, and Ms. Bartolek can speak to this better than I can, but there are a number of interdependencies in how the current version of the tool is designed, and those are certainly the factors that are being considered in the 2.0 redesign. That's a lot of the focus of what's going on from the business and policy side.
Okay, I didn't bring you here to yell at you, but to me, I don't know how many people are dedicated to this. We're spending $250 million a biennium on this project, state and federal. To me, it's all the same money. And we have people outstate who are chafing on some of these screens that make no sense at all. We're burning up money. We haven't got enough staff to go around that are trained. And some people are being way underserved because they were so wrapped up in some of these pointless screens. And so you don't have to answer, but I'm frustrated. It's hard to be a fan and to support that kind of spending when we have people in dire need of not getting enough services with the same pot of money that we're using to do this assessment and support planning. And so I'm just frustrated by that. And I'm impatient for the quality of service that your panel there right now wants to provide. And so I guess there's nowhere to go beyond that, but I don't know why that would be so hard. We have an IT guy at our clinic who doesn't care much what I think, but when they get around to it, they will change their system to something that I point out is much more efficient, and they are slow at that, and I don't know why that is either, because we're supposed to be able to use all these systems in a friendly way and not be the victim of the technology. Anyway.
Mr. Chair?
Senator Hayden, go ahead.
Yeah.
Thank you, Mr. Chair. And so, Mr. Chair, I hear your frustration. I think I shouldn't speak for everybody. I certainly am frustrated when you put it in the context of how many folks, I recognize how many folks you got to serve, but how many folks that are working on the issue. As an observation, or maybe I should ask a question and then give you an observation. So when you think about the revisions that you need to make, or when you're starting to revise the system, regardless of how you got there, how are the end users, the folks that actually use the product, how are they integrated into the process of making the revisions? And at what level do you talk to them? I think you know where I'm going, but maybe I should ask the question first and then reserve my comment till after you answer that question.
Mr. Klein.
Mr. Chair and members, DHS is engaged closely with the counties, and MnCHOICES is in attendance at the design meetings that are going on now, so that the requirements can be captured accurately. So we're at the table with DHS, with the counties, in order to understand the need and translate those accurately into requirements.
So maybe the better question is, I recognize that the county and DHS and MnCHOICES are at the table. How many people who actually do the assessment, the worker, how many of those folks are at the meeting, at the design meeting, when you are talking about the design requirements to restructure the product?
Ms. Bartolek.
Mr. Chair and Senator Hayden, we can get you some of that information, but for example, we have about 700 mentors. These are people in the counties who are the leads, and we meet with them regularly. We go around the state and pull them in. We walk through it. We have an advisory committee with people that use the system. We have subgroups where we've asked the counties to identify who are the right people to come in, and we tackle issues like how are we going to make improvements and reassessments, or you're going to hear in a minute about several of the work groups we've been doing more recently to tackle issues. So, and then any release. Every quarter when we make changes, it's piloted at the county level. So the users use it and tell us what's working, and we can manage it before it's released to everybody. We have a way to pilot it. So there's a great deal of work with people who use the assessment, which is in part why it takes time sometimes to work our way through all of that.
Well, thank you, Ms. Bartalik, and thank you. Oh, excuse me, Mr. Chair, because it seems to me on a practical level, and I know this is complex, that actually should, that if that work is being done, it seems to me that should help. That should get at what the chair and Senator Hoffman is talking about, because the person who typically is using the assessment tool, who's looking at the participant or client in the face, is the one that's coming back to say this module does or doesn't work, or this is the problem we're having, or it's not intuitive. What I found in these projects is that, with all due respect to the engineers who do them, is that they build these in logic that makes sense to them, but often aren't as practical as they need to be when you get in the field. And I won't bring up some of the failures around here that we've had, but that has seemed to be the issue. So I think that what the chair is trying to figure out is why it should take, if someone says this module doesn't work for this reason, why does it take so long for that to be implemented, as opposed to saying, yep, it doesn't work. We checked in with a couple of folks around in different regions. Is this a regional issue, or is this something that's universal? But I guess it's the bigger comment with respecting the work that you do, that it seems to me that there tends to be a lot of voices in the room, but they're not the voices that are talking to the client, and that's where a lot of this time and effort, and what I like to call is the whiteboard. And I've been in many organizations where we've put up the whiteboard and we've wrote out how this thing should work and what the process looks like. And then when you bring in the end user, it makes no sense to them. So hopefully that's not the case. It sounds like it's not, but if it is, I think that the closer you get to the end user and the louder voice that they have in your process, the better off we'll be.
Senator Hayden, thank you. And that's probably a statement, and Senator Hoffman has a question. But I just want to remind the good people at the table here that it's good you're sitting there with the county, at least a county, which is an early adopter and a pilot county. But I just have to tell you that the talk behind the scenes is they're not as happy as you think with this. And I don't know if they don't tell you. And Ms. Bartalik, I know you very well as a person. I know what your intent is. But as an agency, very often the feedback that comes in seems to land on someone's desk as a pile of Post-it notes, and they don't get very far past. So you don't have to react, but maybe you can react if you want. I don't want to.
Mr. Chair, I would like to react. We're well aware of the issues. We meet with counties all the time. Our staff are in all these groups with users. They are facing them, trying to work through it. So there are issues that it is complex, and I am not going to speak for Tom on some of the IT solutions, but I do want all of you to know that we are well aware of it. There is not a day that goes by that the people who are making decisions at the department on a policy level aren't working directly with people who use this, or their managers or clients, about what's not working or what is working, because you also aren't hearing that. And there are some of the efficiencies that we do want to have a chance to get into. So for example, we're finding great efficiencies with a really good support plan where people are really excited about how that assessment can help them actually finish the job of writing up support. So I just want to both assure you, but also whatever we need to do to help you know, we're not turning a blind eye to this. This is something that we are constantly at the table, setting up ways of trying to get information. When we went around the state, we did it because we knew there were issues and we wanted to hear them. And some of it's really hard to hear, but working together, we are figuring it out.
And thank you for that. Maybe your frustration is with this. I don't know you at all, Mr. Klein, and maybe the frustration is the operational challenges of making some of the improvements, so they think you didn't hear, and so they just languish, and so I respect that. Senator Hoffman.
Thank you, Mr. Chair. I think you're going down a road of
the internal process of, we have a work order, whether it be a request for information or you have a work order, and how long does it take that work order to get to a decision, and who along the line has to sign off on those decisions. And I know that's an internal conversation that occurs at the department. I mean, if you could just wave the magic wand, Ms. Bartalik, this stuff would have been fixed a month ago. I mean, it would have been that. And I know, I mean that, because I know your work style, I know your work approach, I know how I know your history, but I know that we've set the bureaucracy and you started by saying how many IT people, 600 to 700. Well, somewhere along the line, somebody gets a work order to do something, but by the time it gets a decision made, how many steps are in there? I mean, really, that's almost an audit look at it, but that can also be our biggest barrier sometimes. And so I think you're going down the right road. Why is it taking so long for us to get to a decision? Why do we still have families and individuals out there who are saying to you and saying to Senator Hayden and to Senator Ralph and Senator Kiffmeyer, we're not happy, right? And I'm glad to hear that there's processes going on, that there's decision groups meeting, but it's still not answering the question on how long does a work order take to get to a decision, and what are those barriers within that lineal line frame to do it, and why is it taking so long? And I mean, I think you're going down the right road. I'd like to see more and more of that discussion, and if it's something that we've set up, let's change it.
Thank you. We have a number of other witnesses, and you have some other content. So if you could highlight the highest valuable points. And I see you have several slides on the money, and I think one mention of that would be good. And where you're going in particular would be productive, like your proactive steps that you're planning to do would be productive. I think the
Mr. Chair,
audience for this,
I'd really like them to get to the slide on page 16 a little bit and explain some things, because I've read ahead.
efficiencies?
I'm sorry, I cheated, and I read
That's
ahead.
okay. You have, your PowerPoint is printed on a different way than my page. So just to know that we do have a number of efficiencies that we are doing, and I want to highlight a couple. Did you want to speak to that group?
One more.
that's the next one, I think.
There we go.
Okay, to talk through here? Sure. So some of these are efficiencies that people have talked about. So for example, having an electronic support plan, taking information from the assessment, moving it in, so then a case manager can take it and complete the plan, get the rate information in, authorize services, has been something that we have been developing with the counties. We have a staggered launch, which means we're bringing in a certain number of counties per week, actually, on this. Right now, I think we have about 60 agencies in this, and they're reporting a savings of 30 to 90 minutes per support plan with this piece of technology. We also, and I think this gets to the point of, can't you just void out and not answer certain questions? How do you do it? We actually have an asterisk by questions that are mandatory. You have to answer them in order to get to eligibility and quality. And we had those two combined. So it was the same. You had to answer them whether it was quality, whether it was eligibility. We've removed the things for quality as far as being mandatory at the time of the assessment. It's reduced the number of questions that have to be asked. There's questions that an assessor should ask, but they could talk to a person and go back to the office and just fill some of that out. So that's also, we're bringing that out. It actually just came out this month, and I don't have the data on it, but our quality assurance staff were reporting during testing that this saved about a third of the typical assessment time. And we also have been making changes such as how often do you have to have it, how long do you have, how many times, because we don't want people, for example, to stay in nursing homes too long. But we actually have extended the period of time based on some data we had about how long people were in for rehabilitative stays. And by making a change on that, we reduced the number of assessments that were required by 14%. Things that are in process that people have also, counties have asked about, we're making a policy change to allow for an assessor to be able to have a legal guardian, for example, participate by phone or Skype instead of having to be physically present. We're also looking at ways that they can update information either by a phone conversation or just based on knowing that the change that's being asked is not anything that would really affect eligibility, but you might want to add a service, or you might want to do something different without having to do more assessments. So there's a number of changes that we've identified in working with the counties that would make a difference. There's more. I mean, there's other things that we're working on, for example, in MnCHOICES 2.0 that will help. So there's a lot of work with efficiencies. We are seeing more efficiencies. We're seeing increased ability to complete things without some of the technology issues. As Tom mentioned, we've been seeing improvements there. So I'm going to go on to the
So I
money.
think that's just, I think everybody's aware of the math. I think we've
Okay.
done a really good job on the policy. Every county here, if they don't know this slide, they don't deserve to be a county anyway. So I think they were aware of this part. And so this has been a really good discussion, I think, and Senator Ralph has a question. But so, thank you for coming, Mr. Klein. And around this table, we care as much as everybody does about these individuals and about quality processes. We are the overseers of that, and working with the department to develop and implement, we help develop. And so it isn't bad for you to know that the people here are cheering for you to be as expeditious as possible in serving the people we care so much about. Senator Ralph.
Thank you, Mr. Chair. Two questions. First of all, just familiarize me, as I understand MnCHOICES, it deals with people that are new to the system and already in the system. I assume that's correct. What provision, and this goes back to data sharing questions, what provisions do we have for when making an assessment or initially bringing somebody into the system who's already being served somewhere in the human service system? What provision is made to provide that person who's doing the assessment with with information that you already have? So that if we have a person with a specific disability, but there's something more to be added, what provision in the system is there now to share that information that you may have received, possibly from a board of district educational district, or from some other agency that's dealing with that person? Is there a cross-fertilization there?
Ms. Bartalik.
Mr. Chair and Senator, that's a good question. So we do have part of the intake process, if somebody's new, the ability to look within the welfare system to see where we know about that person. But you're asking a question that we're actually in the process of working through with the Department of Education, the Department of Vocational Rehabilitation, and those entities that are not part of the welfare system. We are in the process of developing data sharing agreements. We would like the ability for some data that's not identifiable to be shared so we can do better evaluation to understand what's happening. Right now, we're doing it on the basis of people giving consent and then having the ability to share information. But that is actually the crux of a great deal of work going on right now between our agencies to make sure we are able to be more efficient.
Is that good? Well, I want to appreciate your sitting through all this little discussion and the candor that we had on both sides. So this part 2 comes in November, and just to continue to charge you to continue to do as you say and keep working with all the counties. And I hope the counties are talking as honestly to you as they talk to me. So,
Yes.
okay. Okay, thank you. And Ms. Shostam, thank you very much. So, Ms. Huberty, I guess you're next on the list. And then, Miss, who do you want?
I think those two together.
Are you coming together, Ms. Carter and Ms. Okay, yeah, good. Well, welcome to the committee.
Thank you. Good
I
afternoon.
hope you've enjoyed the discussion, and
Absolutely.
people
I
are certainly awake
appreciate-
and engaged. So,
It seems as though that is the case. Thank you so much,
yeah,
Mr.
pleasure to
Chair
have you here, Ms. Carter.
and members.
Yeah.
I'm Tony Carter, Ramsey County Commissioner, and I'm here today representing Minnesota's 87 counties through the Association of Minnesota Counties. I just want to appreciate that you have set aside time here to hear and reflect on these pieces of input from counties. You know that AMC represents 447 county commissioners across Minnesota, and that's in our 87 counties. And we would like to talk with you about the impact that MnCHOICES, and in particular, last year's cost shift has had on counties and on the people that we serve. We are responsible in counties for determining eligibility of individuals for programs, and in the case of MnCHOICES, counties provide assessments so that all our residents can access the services that they need for care and for treatment. Counties are partners, not only in working together to ensure that the residents get timely connected to the services they need, but also for the entire integrity of the system. So I'd like to start by first saying that we all appreciate and very much support the goals of MnCHOICES. As the initiative was created, you may know that Ramsey County was one of the earlier adopters because we wanted to make sure that our residents had the right services at the right time. We wanted to improve the quality of the system so that there would be consistency for the individuals we serve, and so that our staff would also have the technology that they needed in order to improve transparency. We want client services to be person-centered as we work for the clients in order to meet their needs. And this remains an important goal for all of us in the counties and for the people that we serve. In my testimony, I'd like to address 3 areas of concern. First of all, the time that it takes to complete the MnCHOICES assessment. Secondly, the impact that the length of time has on the clients that we serve. And thirdly, the growing cost to counties regarding the assessment tool. So the time that it takes to complete the assessment. The system is complex, and the individuals served do often suffer multiple concerns. They need guidance, significant guidance, in order to be eligible to receive the services that they need. And on average, the processing time for the original assessment is between 10 and 12 hours. Each person served has a variety of needs, and the assessors have to identify and assess those needs. Prior to eligibility, the assessor, in addition to completing the MnCHOICES assessment, coordinates multiple services that are needed across our programming areas, including eligibility for medical assistance and for disability. And they also coordinate with other medical professionals across other areas, for example, mental health workers as well as family members, to get the information that they need to assess the individual's abilities and needs. The length of our assessments, as you'll hear or as you have heard and will hear more about from Melissa Huberty, concerns for our clients are twofold. Completing an assessment can take up to 3 months. And that leaves the client, of course, waiting for the services that they need in order to improve their lives. The number of MnCHOICES assessments continues to grow. And with the increase in cost that counties are now having to pay, counties are put in a very difficult position, needing to choose between increasing staff and managing to the increased cost of the budgets due to the cost shifts. So that brings me to the cost. The MnCHOICES provision included in last year's HHS bill, intended to streamline assessments, is actually now a direct cost shift to our counties, and that without any requirement for program improvement. In recent years, there's been an accelerating trend to balance our state budget by shifting core program costs to county government and therefore property taxpayers. This has done nothing to lower the cost of government or to streamline programs or to spur innovation. The shift itself does not. It simply shifts the cost from one level of government to another and from one set or location of taxpayers to another. County human services budgets are growing, as you know, at alarming rates due to additional now state requirements and cost shifts in mental health and in child protection, and due to the lack of modern technology for our health care program administration. The state booked savings of $19.3 million in full year 18 and 19, and $22.3 million in 2021. But what that means for Ramsey County is that in 2017, we will be paying an estimated $798,671 for the new cost share. In 2018, we're anticipating that this will increase to $1,872,564. On July 1st of 2019, the cost shift will increase from 15.7% to 18.1%, And that, of course, only serves to increase the county's cost burdens. So finally, we have ongoing concerns that the technology updates in MnCHOICES 2.0, which are due to be released in 2018, will not keep up with our growing demands. As you know, counties recently faced challenges in technology rollouts from a number of areas in the state. And as we've seen time and time again, the inefficiencies result in decreased productivity and a need for increased staff. So we do appreciate DHS's commitment to work with counties to achieve these efficiencies. The changes to technology have not yielded, however, those results in a time frame necessary for our counties to be able to do the work. So we'll continue to be at the table as counties as we continue to work with you toward our mutual goal of efficient systems that will assure that our residents are getting the right services at the right time. This is not only an issue for Ramsey County, of course, and for the metro area, who will be picking up a large part of the financial cost. It also is a share of counties across the state. And so here to give insight on how greater Minnesota is impacted, it's Melissa Huberty, who is Stearns County Human Services Administrator. Thank you, Melissa.
Thank you.
Welcome to the committee, Ms. Huberty. Thank you.
Good afternoon, Mr. Chair and committee members. My name is Melissa Huberty, and I'm the Human Services Administrator in Stearns County. I'm here representing the Minnesota Intercounty Association, MICA, also the Minnesota Association of Social Services Administrators, MAXA, and the Association of Minnesota Counties, which is AMC, and I want to thank you for this opportunity to testify today. Commissioner Carter testified that MnCHOICES assessments can take between 10 and 12 hours, and I'm here to walk you through an example of how that can be. And I would like to illustrate this by just telling a story that's a common story, but it can be many other stories to be told. But pretend that we have a Mrs. Smith that comes in on January 1st, and she's referred by her daughter for an initial assessment. Mrs. Smith's daughter expresses her mother's urgent need for supported housing, help with cares, and she's displaying increased memory loss. Prior to the MnCHOICES assessment, the MnCHOICES assessor has to make several phone calls with Mrs. Smith's family to facilitate the required application for financial assistance, to discuss various community-based services, and then the assessment is scheduled within the 20-day time frame. However, prior to the scheduled assessment, Mrs. Smith is hospitalized. This is not an infrequent occurrence that something doesn't happen between the time of the appointment is made and the week or two later with the folks that we're serving. As hospital staff and the MnCHOICES assessor prepare for discharge of Mrs. Smith, no viable community options are available and they can't be found. The MnCHOICES assessor is then responsible for coordinating with the hospital staff for the assessment, and as Mrs. Smith's legal guardian, the daughter must also be involved, which is part of the process and a good evidence-based practice. And as you can imagine, scheduling and rescheduling with family members, hospital staff, and other folks takes some time. So after nearly 3 hours of preparation, which is making phone calls, gathering information from family, working with financial assistance, the assessment begins with a face-to-face interview. This interview can take between 1 and 3 hours, depending upon the client. But let's just pretend that this portion of the assessment is 1 hour for Mrs. Smith. After that interview, there's another hour and a half with the family, and also with hospital staff to review needs and to inform the family of potential services while eligibility is actually being determined. The MnCHOICES assessor then completes the web-based tool, along with gathering the necessary documents to support eligibility and to assure compliance. This work can be completed after the meeting with the client to minimize the amount of time that the client's actually with the assessor, as been mentioned previously. But it takes an additional 5 to 8 hours to enter that required information into the tool, determine eligibility, and then develop a person-centered plan, which is a requirement as part of the Olmstead plan. Once the assessment is completed, the MnCHOICES assessor must communicate with Mrs. Smith and her daughter about waiver eligibility and work closely with hospital social workers as they explore options for placement. Most folks seeking services have unique and complex cases. In total, it takes an average of an additional 10 hours, so in the end, 10 to 12 hours to coordinate with the various stakeholders, complete the assessment, determine final eligibility, and then transition the case to a case manager. And for Mrs. Smith, due to all of these issues, her case wasn't open for case management until March 15th. And by way of reminder, we started in this pretend scenario on January 1.
This resulted in an extended hospital stay for Mrs. Smith. Because that's where she was, and there was no community setting available. And then that we need to have this eligibility done to get the waiver in order to place her in the community. So while we totally believe in the goals of MnCHOICES and we're in partnership with the state to do this, in practice, we're not really meeting people's needs in an efficient manner. But increasing the efficiency of the web-based tool will not really result in significant cost savings. We continue to see a rise in intakes all across the state. We're doing a much better job of identifying issues early on, like autism, we're doing a better job with that, and Alzheimer's, and we have an aging population. So the number of incoming is not reducing, and in fact is rising. And so in Stearns County, each MnCHOICES assessor is expected to complete an average of 12 to 14 new assessments and reassessments per month. I think that's pretty average across the state. It's on the high side. Stearns has hired 2 additional staff members to try to meet these needs, but it doesn't really account for the previously mentioned growth in intakes. So it's always this constant problem of the incoming, and even if you get more and more efficient with the tool, you always have work to do. It's not like it saves money. So the impacts, I guess I would say, it's just a lot of pressures on our human services support network. We lack the community options to place individuals. There's increased costs associated with the services, both of which drive higher caseloads for our workers. And these pressures result in our county not being able to serve the families in an efficient way. So this impacts rural communities who already run on minimal staff. The need for even one new FTE represents a significant financial investment for small counties. And for counties like Stearns, which are regional hubs, this becomes even more significant as clients move to regional centers and to access the services that aren't even available in the rural communities. And this not only takes clients away from their homes, but increases the demand on county staff in these regional centers. So finding ways to serve our clients in the most dignified, efficient, effective way is a shared priority of counties, for you, as policymakers, and we understand and completely support the goals of MnCHOICES, but we want to continue to work with you and the department to improve the quality of the system to ensure consistency in services available for the residents statewide, so that everybody receives the right services at the right time. So we look forward to continued conversations about this shared vision, and some of these items were touched on by my colleagues in DHS, but I just want to be really clear that simply shifting the cost to counties, we cannot get our shared goals achieved by doing that. Streamlining measures that are not integrated into the technology system will not help counties achieve greater efficiency or ensure clients are met in a timely manner. So anyway, I thank you for the opportunity to speak.
I appreciate being here, Ms. Huberty. How long did it take under the legacy system to do an assessment?
Mr. Chair and members of the committee, there are several assessments that were put into one with the MnCHOICES tool. So I think Ms. Bartalik mentioned this earlier on, but it depends upon if they wanted one service or more than one service. And if you wanted one service, it was maybe a couple hours for PCA. But what happens in reality is a person coming in the door wants PCA today, and in 2 weeks they also want a DD waiver, or they want some other service, and then you go back out and you're doing another intake. So they're really comparing apples and oranges, and it's hard to say that it's hard to compare the two systems. So with the one tool, the good part about the one tool, in theory, is that you are doing all the full comprehensive assessment in one shot, one intake.
Yeah, and I presume that you feel that you have Ms. Bartalik's ear on these matters and she's attentive to your concerns.
Mr. Chair and committee members, I completely feel that Ms. Bartalik has been completely in partnership with us on this matter.
Thank you.
We don't always, counties and DHS don't always agree, but I do feel that we have been in communication about this.
I'm happy to hear that. I expected you to say yes. That's why I asked the question. Questions? All right. Well, thank you. And this is going to be taken up. Do you want to say something else, Ms. Carter?
No, I simply wanted to say thank you so much for hearing our frank testimony.
Well, and yeah, we're in this together, and I
Indeed.
respect the commitment you show and on behalf of however many counties you're representing today. Senator Hoffman.
Mr. Chair, thank you. My anecdotal comment earlier now is just validated by the fact you hear 10 to 12 hours I mean, it's just not family-friendly, and I know Bill Amber and folks have got some discussions on how that the assessment needs to also be family-friendly, too. So I think you're going right down the right path you need to, Mr. Chair, and this is going to open up some more discussion, so it's good to hear that.
Happy about that. I think it's 10 to 12 hours of staff time.
I know.
And so, but the people are drifting around in that whole thing. Very helpful.
Thank you.
This is a good discussion. I hope people can are okay with it. Ms. Turner, you want to come down? And then on deck, we'll have Mr. Clapper, Mr. Butson, and Mr. Hughes. And so, yeah, Ms. Turner, welcome back.
Thank you.
You get points for being here at the same table. I think it's just you and Ms. Bartalik get the plaque of the day. We should start having those. That'd be pretty good. Welcome
You can
back.
just give it to me the next time I'm here. So.
Okay. Oh, then you'll just piling on, yeah.
Thank you. So once again, my name's Barb Turner. I'm with ARM, and we represent approximately 150 providers of services to people with disabilities, primarily under the HCBS waiver and in ICF services. I just want to make one comment about MnCHOICES in general. So I've been part of MnCHOICES before it was called MnCHOICES too, as far as the development and whatever, and it's been a long process. And just my one comment is sometimes in the process of fixing it, we hear stories from the worst case, and things change, and those same people don't see the impact because by the time they get an assessment, I just to kind of give some kind of break to the fact that the people who have the bad experiences, it might take a while for them to see a good experience because of how the system works. And I know from stories of working with our members, that's sometimes the case. They bring me a story. By the time I hear it, it's already in process of being fixed, but they're not going to have that same experience again for another year or two. And so to them, that's still their experience. So the primary thing for providers that I want to talk about today is that in this new MnCHOICES process, providers aren't directly involved in the assessment process unless the assessor seeks out information from them. And we've felt, this has been a comment we've raised for a while, we feel that results in sometimes information lacking in the assessment process because although my understanding is assessors are directed to seek out information wherever they think they should get it. If you're already providing services to someone, you probably are a really good resource, but you're not able to sit in those first initial interviews or be part of that initial interview. You have to be reached out to at a separate time. So we would just like we would ask for a better system where we could perhaps submit information unsolicited, but making sure that the pieces of information that a provider who's currently doing services is considered when they're doing those reassessments specifically. We think that would give a better picture of really what the needs were and what is going on for folks, because sometimes the family might be interviewed, but they're a little further removed from the day-to-day kind of comings and goings of the individual. And then the only other comment I want to make, it's fairly new, but we are hopeful that the new process that links a service plan with the MnCHOICE assessment will make the development of those service plans a little more expedient and a little more consistent. One of the things that happened when 245D came into play is there was a lot of inconsistencies in the availability of service plans, the quality and content of service plans, and we're hoping that some link to the assessment might make that, again, be a better level playing field for everyone who's receiving services.
So, Ms. Turner, you're saying that the assessment is done in MnCHOICES, but the application in the form of a service plan isn't always the same everywhere? It
hasn't been up to this point. I think there's a change now in how it's developed so that there will be a better link. But in earlier, prior to now, the assessment would be done, and that would result in something that the case manager might or might not, use in context of developing the ultimate service plan. I think there's going to be a better connection now.
Well, I would hope so, because that seems to be the whole point, is to standardize. If they have a need in northern or southwestern Minnesota, they should have the same proposal, it seems to me. So, and Mr. Klein, if you need consistency across these things here. So anyway, I know it'll take a while to fix that, sorry. Senator Hoffman.
Mr. Chair, and thank you, Ms. Turner, for doing that. As you were talking about some of the inconsistencies, I know there is still screenshotting that occurs versus an integrated system that some of your HCBS providers are taking a screenshot of the service agreement and then emailing that either to or from the county case managers. I mean, it's such an antiquated way of doing it, but I would, is that still happening within the provider? I know it's still happening, but is that still something that pops up? You talk about integration discussion. Why are you still screenshotting stuff and then forwarding it via email in order to make sure that service agreement, which then delays it because there is no internal integrated system that's really saying, all right, this is connected now, this is the service agreement, now go do the services.
And so my experience with the issue of screenshots has more to do with our rate setting system than it does with MnCHOICES, so I'm not sure where that connection might be with MnCHOICES. I do know it's a piece of the process for our rate setting system.
And then just one last thing. I presume that they don't want your information because they figure you're biased. You're just going to want to get more stuff to do, and which to me seems back to this 30 percentile. You know, there's some people that would be dishonest, but it seems like you'd be a good resource. And you know, if you were at least allowed to submit something, because I don't even know if the case manager is going to know what it's been like to serve this person for 6 years.
Right. So I think that is the intent, is to make sure the assessment process is very pure, so that a provider doesn't have any interest in saying, well, they really need X, Y, and Z because that's what I happen to provide. I think, again, I think it's a system where most providers, the good providers, are going to submit accurate information so that people are getting the right services. Good providers don't want inappropriate amounts of resources going to people when they know there's someone else who might need those resources. So it is just trying to figure out how we can get that information. And again, it's been inconsistent. That process has been inconsistent from county to county. So ironically, just this morning got an email from one of my providers who said, we're being told we can't sit in on the meeting even though the individual asked that we be able to sit there. And we've sat in a lot of other meetings. And so kind of whether they can or whether they can't hasn't been handled exactly the same way. And we would just like a consistent way of providers being able to submit what they think is pertinent information. And,
you know, the timing is going perfect on our hearing today, so I'm not going to bring anybody up to talk about that, but maybe Ms. Bartalik, you can talk with the different individuals, and in follow-up meeting in November, we can just see if there's somewhere to go with that. It seems like I understand both sides of the coin, and so, but I think that, especially on behalf of the counties that are spending a lot of time, and it'd be nice to know that, by the way, this isn't going to work. We did this already 4 years ago, and it was a bad idea, and so you're chasing half a day of this working on a thing that's, anyway, not going to work. So thank you very much.
Thank you.
Mr. Clapper and then Mr. Rutson, maybe you can work your way down here as well. And you each have about 5 minutes. And Mr. Hughes, so if you just want to work your way down, and welcome to the committee, and I hope you've enjoyed the discussion. Mr. Clapper, I know you have a lot of thoughts, and you've been part of a lot of these processes, and
I always
appreciate your engagement.
My name is Jim Clapper. I am a parent of a young man, Bob, who is 30 years of age. I'm also a co-leader of Minnesota Families and Advocates Coalition. Mr. Chairman and committee members, I appreciate the opportunity to testify. MnCHOICES has several flaws that my son Bob and I have observed and wish to communicate. I've also had the opportunity to talk to many parents and family members, and their observations are the same. MnCHOICE consolidates actually 3 previously used assessments into one. We've heard all that, so I won't go through that again, but this new one-size-fits-all assessment has many questions that are just not relevant. It consumes way too much time to complete and creates unnecessary aggravation for the person being assessed. This is hardly a person-centered approach. It was interesting in Bob's assessment that when we finally got to the questions that were germane to his situation, the assessor referred to his DD screening tool. Apparently, the old DD screening tool was actually quite useful after all. If this is really a true consolidation, there should be fewer resources and money to carry out the process. So I'm concerned about how much money we're spending and going to be spending on this down the road, as well as the cost shifting we learned about today. Probably the most serious critical issue I see is around what the impact has been to case management. I've heard numerous stories from parents and family members about ineffective case management services and high turnover of case managers. MnCHOICES is one of the root causes of this critical service deterioration. We have been told that new assessors for MnCHOICES have been taken from the ranks of experienced case managers, and that case management is being contracted out to third-party companies. The role of the case manager is incredibly vital for the person with disabilities and his or her parents and family members. It is very difficult to see good experienced case managers get moved into the assessor's positions and then have indirect case managers from contractors take their place. Reduced quality of case management and high turnover rates have been experienced since MnCHOICES created this change. It is very aggravating to the parents and family members that I've talked to. And last but not least, MnCHOICES assessments has specific exclusions. This has been talked about by Barb Turner just recently. Existing service providers are not allowed in the assessment, even though they have some great knowledge of the individual being assessed. I've been told that it is a conflict of interest to have them attend. If the individual being assessed wants them in there, then I think it's a conflict of interest to prevent them from being and attending the assessment. In my son's case, he was able to request and was given the okay to have representatives from his existing service providers in attendance, but this was an exception. We were also told at one time that the existing case manager could not attend the assessment, as a key principle is to separate assessment and case management. It's also duplication of costs is one of the rationales that I was given as well. These exclusions are contrary to the principle of person-centered planning. So at least from my limited perspective and the others I've talked to, the parents and so forth, the bottom line is MnCHOICES is not really fulfilling its promises to improve person-centered planning and improve quality of life for their participants. It is another big process that seems to be creating more problems and costs than it is solving. Thank you for letting me testify.
Thank you, Mr. Clapper. Any questions? No, I appreciate you as a parent and your engagement, and it really does matter, and it helps to hear from all parties, and so you provide a good testimony. I'm grateful.
Thank you very much.
Yeah, and we'll be back in November, and I presume that you know who to talk to at DHS about various things.
Oh, yeah. I know them quite well, and they listen very well, so I'm very pleased with that relationship.
Thank you. See? The ear's working. Mr. Rutson. And then, Mark, if you just want to come up, you can wheel up next to him there. Maybe move that chair away. Looks like you got a twofer here, huh? So, Mark, you can use is that swing mic on, or you can pull up at the table, whichever you like when Mr. Clapper gets out of there. Mr. Rutson, hello.
Hello.
Who do you have with you?
I have my girlfriend, Kim Whittick, and I would just let her speak for a minute, and then I would do my testimony, but...
she can have one of your 4 minutes, Mr. Wilson, it's fine. We'd rather hear from her anyway, actually.
And I have one.
I was not prepared to speak.
But I just would like to, just so I love all of you, so you know that already, so don't take this personally. But when Mom was alive, PCA Services, she lives in Hugo, Minnesota, and they were terrible, the PCA Services. So just put that back in your mind, and maybe if she wants to say anything else, please. Honey,
we did have a very difficult time finding services, and then when the services that we found were in Minneapolis, and then they wouldn't show up. You know, we would be scheduled. I'm an only child of my mom who lived in my home, and so when I would go to work, I had the expectation that they would come and help her out when I wasn't there, and then they would just not show up. So it was difficult. As the sicker that she got, the more help that she needed, and they didn't come to help. So it was really difficult to find the quality help that I needed for my mom. So, but I was really
Liz, you should
prepared.
tell us your name. Tell us your name officially for the tape.
My name is Kimberly Whittick.
Kimberly, yeah.
Yep.
Thanks. Do you want to say something else, Mr. Rutson?
Sure. I just want to remind you guys, I just had a few comments. and then I take any questions. And we can talk, you guys, until we're blue in the face about everything, about numbers, about how much it's costing, this or that. But when will we start to really talk about real solutions to this problem? We need to get down to real solutions. There is no golden bullet or no silver bullet. And we all need to work together like we're doing. And like I said, I love all of you. You know that already. So just know that from the bottom of my heart. And I take it to like a flat tire, like on a Mercedes Benz or a really nice car like Senator Hoffman has. You know, he's taken me for breakfast a few times. And yeah?
Yeah, keep going.
And
Keep digging your hole.
I find it like a flat tire. You got a flat tire, and it's fascinating. And then you let me show the rest of the car. Oh, isn't this great inside? Without focusing on the flat tire. We need to focus, fix the flat tire, and do it in a you know, sometimes, I mean, like in my church, and Jim's on my team, on my committee with different folks, and I appreciate Jim and all you guys more than you know, but sometimes, like the disabled guy that I take care of in our church, they don't have time for like MnCHOICES, so we need to do a better job at just simple and they will always be on everything, you guys. You know this too, fraud. They will always be on everything fraud. Look at Washington right now, but I'm kidding. I'm not really, but please think about this and let's all work together and get a system in place for the best of Minnesota. Let's get it done. And I'm in with you guys, and I thank you for taking my testimony. Thank you.
Thank you, Mr. Rutson. We need to fix the flat tire. Exactly. Stay there. You can stay there and relax. Mr. Hughes, welcome to the committee. Is that thing on?
I believe so.
Okay, good.
Here.
Sweet, yeah.
I think it's on.
I can hear you now.
Good afternoon. Good afternoon, Chair Abler, members of the committee. My name is Mark Hughes, and I have a couple comments, and I hope they're pretty important. They are in my little world. First of all, on the PCA issue, and I want to answer Senator Rolfe. We had the data this morning and trying to figure out what to do next and how to do it and make it a win-win for everybody. My assessment is this: if you're going to pay people $11 or $12 an hour, they won't be there. It's like Metro Mobility, and we're not here to talk about Metro Mobility today, but that's about what they start out as, $12 to $14 an hour, and those people are always moving on. And so I've kind of put the pencil to the paper and figured out that we should equate and set up educational programs and entice people to come to work as PCA and make it more of a career, and have educational programs, times it by the hours by which they've served, and then have a tiered paid system. In other words, as you gain more education, as you gain hours of service, you kind of work your way up to the pay scale. Now, it's up to the legislature how to find the money. That's your job. These are vulnerable adults. They need to be taken care of. In my own case, I can't put on my own shoes and socks and tie, but I still hope you'll take me in here every day for the person that I might be, but there's a bunch of disabled folks who need this service. And I can't say it any more serious than that. At some point, everybody will join our little community. And the other question I had, when it came to Minnesota state fraud as far as the PCA companies, you're firing and suspending the employees, which rightly so, it probably should be. But you also need to take a look at that company and null and void the contract and then find new contracts. If you remember several years ago on Fox 9, their investigative team did a investigative report whereby a PCA company in Minnesota charged the state of Minnesota $350,000 the minute computer didn't flag it. We had minute computation that couldn't flag that big a mistake. Now, I don't know, I hope the state got the money back, but I'm concerned about these things. $1.4 million in fraud in 2016. And people suspend and fire the employees, but they won't null and void the contract. They're going to keep on using these same companies. We need to take a good look at this whole system. This is our government. We're the people of the state of Minnesota. We have the right to vote. We're business people, and I'm concerned. Thank you.
Thank you, Mr. Hughes, and I don't know if you've testified before. Have you been down?
What's
You've
that?
been around here all the time, and I just don't remember seeing you at the table, so it's good to have you down and good to hear what's on your mind.
Thank you.
I think this has been a productive time together, and I think over the course of the day, we've covered a lot of the spectrum, but even in this hearing where we were focusing on this tool and the planning, at the end of the pipeline are people being served by the very planning and technology and all those headaches that people get from that. And at the end of the day, it's about serving individuals who need what we have to offer in the best way possible. And each of us in the room is committed to that. I think it's kind of fitting to end with the last four testifiers, in a kind of a real way to get our feet back on the ground about this. So I will speak on behalf of the committee. I know they're all interested in weighing in to make a difference about this, and I in particular, and so my door is open. Tomorrow, we're going to be taking up child care and matters of that, a little different flavor. But I thank everybody who participated. It was a very good hearing, lots of good information, and God bless you all. We're adjourned.